Om Swastiastu. Hello everyone, we are from small group session B6 and we will present our small group session student project with the title NASAL POLYPS. And this is the name our small group session member.
Greetings, I'm Mario with student number 123, and I would like to talk about nasal polyps before we dive deeper into the disease. Nasal polyps usually grows as a manifestation of rhinosinusitis and uncontrolled allergies, which grows from the nasal sinus mucosa. It can cause obstructions and lots of other symptoms, and may cause the decrease of quality of life. That's all for the background. I'll be giving the next explanation to my friend. Thank you.
Hello everyone, my name is Putu Sarananta with the last digit student number 021. So today I will explain to you about our student project. Problem statement, objective, and benefits. So the problem statement, the first one is what is the definition of nasal polyps and what is the epidemiology of nasal polyps, what is the pathophysiology of nasal polyps, what are the clinical manifestations of nasal polyps, what are diagnosis and treatment of nasal polyps, what are the prognosis and complication of nasal polyps, and what are the information and education about nasal polyps. And the objective, there is two of them. The first one is general objective, to explain how about nasal polyps and get to know more information and knowledge about nasal polyps. And a specific objective, there are explain about the definition of nasal polyps, describe about epidemiology and pathophysiology of nasal polyps, and to know about clinical manifestation of nasal polyps, and to mention about diagnosis and treatment of nasal polyps, and explain about the prognosis and complication of nasal polyps, and the last one is to get more information and education about nasal polyps. Okay, next slide. So here our student project benefits. So from the process of building this project, the writers realized that there are several benefits of this student project, which are: the first one, the authors are expected to add more insight into nasal polyps and hopefully can educate a wide community about it. And for other authors, it is hoped that this can be a reference for further studies regarding in more depth matters regarding nasal polyps. Okay, that's all for me. Thank you.
Hello, doctors and friends. My name is Tirza Fitani Amaris with the last three digits of my student numbers are 0C0. I will continue about the definition and epidemiology of nasal polyps. So, nasal polyps or polypnaceae are benign, soft, painless growths that develop in the lining of the nasal passages or sinuses due to chronic inflammation. These polypoid masses are non-cancerous and result from prolonged irritation or infection, commonly associated with conditions such as chronic rhinosinusitis, asthma, or allergic rhinitis. Nasal polyps often present as teardrop-shaped lesions and can vary in size, sometimes large enough to obstruct the nasal cavity and cause breathing difficulties, decreased sense of smell, and frequent infections. Nasal polyps affect approximately 1 to 4% of the global population, with higher prevalence rates in adults over the age of 40 and in males compared to females. They are most commonly found in patients with chronic rhinosinusitis, where around 20 to 40% of those diagnosed may develop nasal polyps. A study conducted between 2018 and 2022 highlighted an increase in nasal polyp diagnosis among patients with allergic rhinitis in urban areas, likely linked to rising pollution levels and airborne allergens. That's all from me, and the presentation will be continued by my friend. Thank you.
Greetings everybody, my name is Gabrielle from Rustafita with my last three digits number being 118, and today I'd like to present about the diagnosis of nasal polyps. In order to establish the diagnosis of nasal polyps, the first thing that I could done is history taking and symptoms evaluations. Patients with progressive nasal obstruction, nasal congestion, rhinorrhea, and decreased sense of smell should be suspected of nasal polyps. However, due to its broad symptoms, the diagnosis of nasal polyps can be completed only by its clinical manifestations. You could also done a physical examinations that help to confirm the diagnosis. Anterior rhinoscopy or a nasal endoscopic examinations is the most frequently used instrument for nasal polyps, which is a procedure that involves inserting a small camera into the nasal passage and helping to visualize the growth directly. The endoscopic result reveals either unilateral or bilateral, mobile, smooth, gray, and semi-translucent masses originating from the sphenoethmoid recess or middle meatus. There's also supporting examination that you could done in order to confirm the diagnosis even more. There are paranasal sinus CT scans, which help to determine its severity and the exact locations of the polyps, and also allergy tests that used to identify potential allergens contributing to nasal inflammations and the polyps itself. That would be all from me. Thank you.
Hello, my name is Kalan Hetantan with the last two digits of my SIN numbers 145, and today I will discuss about the prognosis and complications of nasal polyps. So the prognosis for individuals with nasal polyps varies on several factors, including the underlying cause, the presence of coexisting conditions or illness, and response to treatment. So in general, nasal polyps are typically not life-threatening. However, because the illness is likely to recur, continuous care may be necessary to prevent lowering of the patient's quality of life. Patients frequently see a major improvement in their general health and a reduction in symptoms when they follow their treatment plans and take care of any related disease. But the complications, nasal polyps have the ability to obstruct sinus openings, which can cause mucus to accumulate and foster the growth of bacteria, causing recurrent sinus infections. In addition to sinusitis, nasal polyps can also contribute to obstructive sleep apnea, especially when they are large enough to impede airflow during sleep. And last but not least, nasal polyps can alter taste and smell, possibly reducing quality of life and cause mental health problems for the patients. Maybe that's all from me. Thank you.
My name is Nila Putiswari Arudarani with my last three-digit number is 183, and now I will tell you about the pathophysiology of nasal polyps. Nasal polyps are benign, painless growths that originate in the ethmoid sinuses and impact the paranasal sinuses and nasal mucosa. The exact cause of polyp growth is yet unknown. There are various pathophysiologies for nasal polyps. Patients are more likely to develop polyps as a result of number of anatomical and functional changes that occurs in the aging body. These changes include thick mucus stasis and poor clearance of irritants and biologic offenders such as viruses, bacteria, and fungi. These alterations include reduced mucus secretion, atrophy of the sinonasal mucosa with decreased vasculature, and decreased ciliary beat frequency with poor mucociliary clearance. All of this could lead to a disruption in the regular osmotic control between cells and an increase in the permeability of the epithelial basement membrane. Generalized edema and the persistent inflammation that follows cause a localized enlargement of cells and tissue. Thank you.
Hello, my name is Ananta Ismail with the last digit number of 198, and now I'm going to explain about the clinical manifestation of nasal polyps. Nasal polyps are benign growth in the nasal passage and sinuses. Nasal polyps frequently cause obstructive symptoms like nasal congestion, stuffiness, and significant smell loss, making breathing difficult through the nose. Postnasal drip is also common, leading to coughing and throat irritation. Patients with nasal polyps are also often experience respiratory symptoms including chronic rhinosinusitis, characterized by persistent nasal discharge, facial pain, sinus pressure, and headaches. Due to significant inflammation, patients may also have wheezing or asthma-like symptoms. Allergic rhinitis is another condition linked to nasal polyps, causing symptoms like sneezing, runny nose, and itchy eyes. Maybe that's all from
Myself,
me.
as my name is Komang Tangkas Indonesia with the last digit number 4, and I will explain about clinical manifestation of nasal polyps. In addition, there are also conditions related to nasal polyps such as chronic rhinosinusitis. Nasal polyps are often seen in patients with chronic rhinosinusitis, characteristic by prolonged inflammation of the nasal and sinus mucosa. Other than that, there are also eosinophilic condition. Chronic rhinosinusitis with nasal polyp eosinophilic is a subtype characterized by high level of eosinophils in nasal tissue, leading to more severe symptoms and higher possibility of asthma and allergy. There is also allergic rhinitis. There is strong association between allergic rhinitis and nasal polyps. With what condition sharing similar information, but way allergic rhinitis can cause prolonged inflammation in the nose, which in turn can trigger the formation of nasal polyps. Additionally, individuals with allergic rhinitis tend to have a more active immune response, which may contribute to the development of polyps. That's all for me. Thank you.
Hello, my
Nice.
name is Laura Natasha Putih with the last digit Matsuri number 083. Now I'll explain about the treatment of nasal polyps. The main targets in the management of nasal polyps are to reduce symptoms, prevent complication, and prevent recurrence. Management of nasal polyps consists of medication and surgery. The first one is medication. The first line medication used are corticosteroids. Local administration of corticosteroids will reduce symptoms of nasal congestion and polyp size. And if the patient has been given all treatment, oral systemic corticosteroids can be given. The second one is surgery. Surgery is performed to remove anatomical obstruction and restore smooth mucosal drainage. Surgery can be done in several ways, namely polyp extraction, which will take and remove polyps using polyp snare technique, ethmoidectomy, which remove all polyp tissue along the ethmoid cells, facilitate ethmoid drainage and prevent complication to the frontal and maxillary sinuses, Caldwell lock, which can be done by opening the maxillary sinus through the canine fossa, and the last one is functional endoscopic sinus surgery, which carry out by opening and cleaning area using an endoscope that has a suction device. That's all from me. The next material will be brought by my friend. Thank you.
Okay, let me introduce myself. My name is Yanti Graciela, with my last 3 student number is 162. Nasal polyps are a benign hyperplastic tissue growths on the sinonasal mucosa. Nasal polyps usually occur in patients with chronic rhinosinusitis. Primary symptoms that may appear are nasal congestion, discomfort due to a mass in the nose, hyposmia or anosmia, while secondary symptoms are postnasal drip, rhinorrhea, headache, facial pain, feeling of fullness in the ear, and sleep disturbances. Although classified as a benign, nasal polyps can affect the patient's quality of life. Nasal polyps are a diagnosis that can occur in several diseases. The most common causative diseases are chronic rhinosinusitis and chronic nasal obstruction. In the Western Hemisphere, nasal polyps mostly occur due to eosinophilia driven by T helper 2 cell, IgE, and increased interleukin-5. These chemical mediators appear due to environmental allergy triggers or changes in season. Therefore, it is important to always maintain health in extreme environmental changes. For people who have been diagnosed with nasal polyp, it is important to maintain compliance with treatment.
So let me continue the presentation. My name is Audrey Esther, with the last 3 digit of student number is 142. We come into conclusion that nasal polyps are benign, painless growths caused by chronic inflammation in the nasal passages and sinuses, often linked to conditions like chronic rhinosinusitis, asthma, and allergic rhinitis. They affect about 1 to 4% of the global population, especially adults over 40, and those with asthma or aspirin-exacerbated respiratory disease. And while the exact cause is unclear, inflammation, particularly eosinophil-driven, plays a key role. Symptoms include nasal obstruction, loss of smell, and breathing difficulties, which can significantly reduce quality of life. Diagnosis involves endoscopy and CT scans, and treatment usually begins with corticosteroids to reduce the inflammation. In more severe cases, surgery might be necessary. Even though nasal polyps are not life-threatening, they often recur, requiring ongoing management. Complications can include chronic sinusitis and obstructive sleep apnea. Educating patients on consistent treatment and preventive care is essential to improving outcomes and maintaining quality of life.
Greetings everyone, my name is Herbert with the last 3 digits number of 169. So for managing nasal polyps, the recommendations include enhancing patients' educations about the importance of long-term treatment adherence, particularly the use of nasal saline irrigations and intranasal corticosteroids to prevent recurrence. A comprehensive management approach, including the evaluations of environmental factors such as pollutants and allergens, is highly recommended. Additionally, treatment and innovations such as the use of biological therapies, particularly monoclonal antibodies targeting interleukin-5, can be considered for severe or recurrent cases of nasal polyps. And also, multidisciplinary collaboration with allergists, pulmonologists, and ENT specialists is also crucial for comprehensive management, especially in patients with comorbid and some other congenital disease conditions. That's all for our presentations. Thank you for watching, and we apologize if there are any mistakes in our words and our doing.